Hello, guys. Good evening, everyone. Welcome to today's class. So today we are up with orthopedics. We're going to learn few important questions from this subject for your upcoming exams. So this is Farre series for the fourth prof. Hope you're all ready, waiting. Good evening, Sabyasachi. So can you hear me? Good evening, Purna. So everything is clear, right? From your side, you can hear me. You can see, hear. So let's start the class without further delay. Okay. So now today we have come up with the topics of trauma. Oh, thanks for the compliment, Sabyasachi. Are you somewhere related to the designer Sabyasachi from Kolkata? So now this year also you keep watching it. It would be really amazing than the last year session because we have updated ourselves now. So now today our first topic. Today we are going to discuss about the fractures and then the healing of the fractures. Then few important complications of the fractures and then specific fractures in upper limb and then fractures in the lower limb. Right. So now I'm starting with the fracture. So let us now start from the very basic. If you want to attend a orthopedics exam, any exam. Good evening, Ayush Swain. So today we are going to learn about the fractures, that is trauma. So trauma is a very important. Sorry for that inconvenience. Okay. Yes. Okay, at the rate of boys official 380, you have no problem. You will not have that problem with me because I don't know Hindi properly, so I will speak only in English. Okay, don't worry. So other faculty, they are basically from North India, so they will speak Hindi, but I am completely South India from Andhra Pradesh, so I speak only English for you all to understand it clearly. Okay. Okay then. Ha. Putting all this aside, now we are going to learn only orthopedics here, nothing else. So first, let us basically start from what is trauma. Okay, so any exam you're going to attend, either it could be a NEET, PG, FMG, INICET, or prof exams. Further, you want to attend your UK exams, USMLE, everything. If they want to ask something from orthopedics, it would be definitely the majority of the questions would be from trauma. Okay, so never neglect trauma. Okay, never neglect trauma. And now today I'm going to teach you in detail and I'm going to tell you tips and tricks to how to write your prof exams but not neglecting the concept. So here we are not mugging up. So no mnemonics, everything we are going to understand with the logic so that you will not forget further in the exam as well. Okay? Yes. Yes. Sorry. I'm starting. Yes. So now first let me know what is the first fracture on the screen. So what is this fracture? So just think you are a basic MBBS student, first, second prof, any prof. Just tell me what are the things you see on the X-ray. Yes, you can see that. So you can see there is a femur, there is a tibia, and there is one sesamoid bone. Yes, answer that. What is that sesamoid bone you're seeing on the screen? This is nothing but your, yes, it is a patella, right? So this is a patella, and you can see there is a fracture in the patella. So for that, then what is a fracture? So what is a fracture? Fracture is nothing but a break in the cortex, a break in the cortex, right? So whenever there is a break in the cortex, so default it will become there is a disruption in the continuity, disruption in the continuity, right? Yes, very good. So there is a disruption in the continuity. But see, patella is not associated with when any bone above and any bone below. But what is this disruption in the continuity with the patella? So is this called a fracture or not? Is my question clear to you? So you see this particular fracture, the second fracture here, you see there is a fracture here. So you can absolutely tell there is no continuity in this bone, right? So the tibia is not connected with the femur, and here again it is not connected with the upper tibia. So there is a break. But the patella, if you see, there is no bone above and there is no bone below. But still I'm telling this is a fracture, and still it breaks the continuity. So what is that continuity which I'm talking about? So this continuity, what I'm talking about is about the extensor apparatus. So this is about the extensor apparatus. Okay. So whenever you see a patella, just imagine that there are tendons to it. Good evening, Himanshu. Good evening, Mohammed Irfan. So this is the, what is this tendon called? This is called the quadriceps tendon, and this is called your patella tendon. So this together, the quadriceps tendon, the patella and your patella tendon together form the extensor apparatus, which is very, very important for your knee extension. Right? It is very important for your knee extension. And whenever there is a break in this fracture, so whenever there is a break in this fracture, so there will be loss of the extension. So the patient cannot extend the knee completely. So hence this patella fracture is very, very important to us. And now can you tell me what is this fracture here? So I've told you that is a patella fracture. So there is a break in the continuity, right? And then what is this fracture? What is this fracture? So here what I'm trying to tell you is this is also a fracture, right? And now what is this? There is also a fracture. So this is also a fracture. Now, can you tell me what is the difference between these three I'm trying to tell you? So I'm telling you that this is a fracture, right? And this is also a fracture, and this is also a fracture. So now imagine that you're on a call, emergency duty, you're in the casualty, and these are the x-rays, these are the patients of a single family. They have come to your casualty, and you're going to update this to your seniors or your professors, whomever it may be. So how do you connect with them? So how do you communicate with them, thinking that there is no WhatsApp? So nowadays WhatsApp has made it very easy sending the photos wherever you want, but there is no WhatsApp. You're in a remote area. So now how are you going to describe these fractures? So why I'm trying to classify these fractures is, first, classification is very, very important for communication, right? For communication, and then to decide the management. So then only your senior can tell you what is the management of that particular fracture, right? And then the third and most important point, the prognosis, because the patients are concerned not about your quadriceps tendon, not about your patella tendon, not about your extensor mechanism, but they're concerned about the prognosis. They're going to ask you what is the next step in the future, whether I'm going to walk or not in the future, what is going to happen to me. So you have to explain the prognosis also, right? So this is why classification plays a very, very important role, right? So whenever we're going to answer what is a fracture, these things, or classify the fracture, bone fractures, these are the three things which you're going to communicate to the examiner, right? Aishman, what is that? You're asking question to me? Patient is shortened external rotated limb, most likely fracture. Should I answer that? It is most likely IT fracture, right? So that is why the classification of the bone fractures is very, very important. And now, can you tell me what is the difference between these three fractures? So this is fracture 1, fracture 2, fracture 3, right? Samantha. So what I was trying to tell the people, yes, IT fracture, yes, right. So what I'm trying to tell you people is, so first fracture is a patella fracture. If you see that patella fracture, so whenever there is a fracture, what happens, there will be a break in the continuity, and this fracture will result in displacement of the fragment. So one part becomes two parts. So the patella was a single bone. Now because of the fracture, it has become two fragments, right? So now this becomes the proximal fragment and this becomes the distal fragment. The proximal fragment, which is attached to the quadriceps tendon, this is the quadriceps tendon what we were talking about, and this is the patella tendon, right? So now if somebody is on the line and if they want to know what type of fracture is this, now I'm going to tell you that this is a undisplaced transverse fracture of patella. Okay, and then if you're clinically present on field, then you're going to tell me, is this fracture or open fracture or a closed fracture? Very, very important. So if it is an open fracture, you have to be very important because this is open to the external environment, right? Closed fractures has no such opening to the external environment, right? Fine. So this is an undisplaced fracture. Then what is the second one? If you see the second one, so what is the second one? The second one is a mildly displaced fracture. The second one is a mildly displaced fracture, right? So still the contact between the two fragments is there. So it is not completely displaced, right? It is mildly displaced fracture. And if you see the third one is, this is called the complete displacement. So this is called your complete displacement. So whenever you're telling somebody that this fracture is completely displaced, that means this requires surgical treatment. So this requires surgical treatment. And whenever we say this is an undisplaced fracture, so undisplaced fracture usually can be treated conservatively. So they can be treated conservatively, right? So undisplaced and open is completely different, Samantha. Open or closed is based upon whether the fracture is exposed to the environment or not. And undisplaced is if you see this particular fracture. So if you see this particular fracture, these are the two fragments and the fragments are still they're completely in contact with each other. Then you have to compare this with this particular X-ray where you see the fracture fragments are completely not in contact. So this is called a complete displacement. This is called a mild displacement, right? And this is called an undisplaced fracture. Undisplaced fracture. Is this clear, guys? So now we have come to a conclusion that the fractures can be classified first based upon their injury, right? Whether it is an open fracture or a closed fracture. So first point is based upon the injury. So whether it is an open fracture or a closed fracture. Next one, it can be based upon the etiology. So how does a fracture actually happen? So fracture actually happen with a force, right? So there should be some force which is acting abnormally. This force can be a low force or this can be a high force, or this force can also be called as a velocity. So whatever might it be, if there is a force, then it is said to be a traumatic fracture. So there is some involvement of trauma which is there, hence it is called a traumatic fracture. This is based upon the etiology, right? It is based upon the etiology. And sometimes without no force, there is no force, right? But where is a repetitive force. So daily some amount of force is acting on it. So that particular forces will produce a fracture which is called as a stress fracture. And sometimes with a very, very low velocity, because the bone is already weak, it produces what is called as the pathological fracture, right? So this is how you can classify. So the first, as soon as patient enters, you will see whether the injury is an open or closed. So you will see the wound. If the wound is there above the fracture, it is called an open fracture. If it is a completely closed, so there is no wounds on the fracture, so hence it is called a closed fracture. The second classification is based on the etiology. So whenever you talk about the etiology, so whether this was a traumatic fracture, whether it was a repetitive fracture, whether it was a low velocity fracture, but even then the fracture has occurred, then you have to see the bone. If the bone itself is weak, then it is called a pathological fracture. So based upon the etiology, we have three types of fractures. One is traumatic, the second one is pathological, and the third one is your stress fracture, right? Now you can answer what are these, no, without any confusion, right? So this trauma, again going back, can be a low or a high, right? If it is a very, very high trauma, this fractures can further be divided into a simple fracture or a complex fracture, right? So if it is a simple fracture, for example, like your transverse fracture. If it is a complex, it is like your comminuted fracture. So what do you mean by comminuted fracture? Multiple fragments. The bone breaks into multiple fragments, right? So bone breaks into multiple fragments, right? So once again, I'll explain you this. So whenever there is a etiology based, it will be a traumatic fracture. So this traumatic fracture happens because of a force. So the patient will fall down with the force, or somebody will hit him with the force, or they will collide with the bike with the force. So this traumatic fracture will result in a simple fracture, or it could be a complex fracture. Okay. Then there is a type of fracture which is called a stress fracture. What is this stress fracture? This doesn't occur with a high force or a low force, but because of the repetitive forces. So what is that repetitive forces? For example, this is called also as a march fracture. So very, very important question. Even they can ask you as an MCQ. So it is called the march fracture. So what do you mean by a march fracture? So march fracture is nothing but it is usually seen in the soldiers who march regularly. So whenever they put that force on the metacarpals, so day by day, they put that repetitive force, right? So continuous forces are put on one particular point. So that is especially your second metatarsal head, right? So that is the area where usually will touch the ground on continuous marching. So over a period of time, over a 1 month or a 2 months, then they will observe slight pain, and then we take an X-ray and see this stress fracture. So this is because of the repetitive force, very low force, but on continuous repetition. Then the third variety is pathological fracture. That means the bone is already weak. For example, there is a cancer. So it is an osteosarcoma, or there is a metastasis in the bone, or there is a Paget's disease in the bone, right? So all this will weaken the bone, or there is a simple bone cyst in the bone already. So there is a cyst in the bone. And even with the limited force means just as they walk up, or they come down the steps and they slip and they fall. So then because of this low velocity injury, then there will be a fracture which is called as the pathological fracture, right? Right. So this are the this is the main basic classification. And now you can see that this fracture can also be divided based upon the pattern, right? Based upon the pattern. As I told you, the forces acting on the bone will result so there are certain forces which will result in the fractures, right? So these forces can be a compression force, right? A twisting force, a bending force, or a tension force, right? So you can do varieties in the bone, right? You can just bend the bone like this, or you can compress the bone like this, right? Or you can pull the bone like this, like the tension, and then you can twist the bone like this, right? So these are the variety of the forces which act on the bone. So depending upon the mechanism of the injury, right? For example, if you're falling on an outstretched hand, so there will be a compression here on the distal radius, hence the patient will have fracture, right? Or if the patient is getting down the steps, then they suddenly they slip, so there will be a twisting force. So these are the various forces which will act on the bone, and then they will result in certain patterns. For example, a transverse fracture. For example, a transverse fracture usually seen in case of your tension. So whenever there is a pull on the either side, there will be a slit, that is a transverse fracture, right? Or there could be a spiral fracture. So whenever there is a twisting happening, this will result in a spiral fracture. And then you have segmental fracture. So what do you mean by segmental fracture? So segmental fracture is, now this is your bone, right? Imagine that this is your bone, and now the fracture breaks at 2 points. So this is a fracture at one point, and then there is a fracture at the other point, right? So there is a segment of the bone which is seen. So this is the segment of the bone. So whenever the fracture is this pattern, this is called as the segmental fracture. So there are transverse fractures, spiral fractures, segmental fractures, right? And then you can see comminuted fractures. Tahir, what you want me to repeat? So what was your question, Samantha? How it is called undisplaced and open? I have told you, right? Undisplaced is whether the fragments are not displaced. See, this is the fracture. Where is that? See, this is the fracture. You can see a slight fracture there. Samantha, you can see the fracture there, right? This is the fracture, right? And here, if you see, when you compare this with this particular fracture, so this is also a fracture, right? So whenever you see the fracture, there is a break in the bone. And whenever there is a break in the bone, the fragments displace, right? Here, there is no displacement of the fragments. So when you go back and see other patella fractures, the fragments move up and this fragment will move down. But there is no such movement in the fragments, right? So hence this is called as an undisplaced fracture. And whenever this fracture is not exposed to the outside environment, this is called as a closed fracture, right? And here if you see, there is a displacement, but this displacement is not as aggressive as this particular displacement, right? So when you see this forearm bone, the fragments are completely displaced. So here you can see there is some contact between the two fragments, hence this is called as mildly displaced. So there is a displacement, but still there is a contact between the two surfaces, right? So this is called a mild displacement. And then what do you want to know? Yes, Abhyasachi, what is your question? Ma'am, putting stress over. Okay. So what happens is, yes, this is a very good question, Sabyasachi. So whenever there is, for example, if this is a bone, imagine that this is a bone. Now I'm trying to break it. It will not break because it can withstand certain amount of force, right? If I go beyond that force and try to break it, then it will obviously break. But what happens in the stress fracture is, every time we are weakening that particular part, putting the force above it. So if it takes, for example, 10 newtons of force, so daily we are putting it 11, 11.5, 12, 12.5, like that. We are increasing the force, so we are not giving the time to heal. Hence the bone becomes weak and result in this stress fracture, right? Bones can only take up some amount of force, right? Not, it cannot take large amount of forces. What you have, okay, what you're trying to tell is the bones will become stronger as they use them based upon the Wolff's law. So what does Wolff's law say is, if you put little amount of stress on the bone daily, the bone will try to become good, and it will, because the formation of the bone and the resorption of the bone will be in dynamicity. So once the bone will form, and then it will get resorbed one, and then it's formed. So whenever you use the bones, they become more and more stronger, but that is to some extent. If the forces are above the level of, withstanding that pressure, then the bones tend to break. Hope I'm clear. Sabyasachi, is your point, I mean, is your doubt answered, or you want in more detailed explanation? Yes, Mahesh, it's better you start watching from start. Yes, yes, that's good. Sabyasachi, I want you to, reply whether your doubt has been answered or not. Okay, then I'm moving forward. So now I'll tell you these patterns. So these are the patterns what I'm trying to tell you. So this is a transverse fracture. So I have explained you transverse fracture. There is a pull upward and downward. That is the tension pull. Hence you will have a transverse fracture, and this is supposed to be a simple fracture. For example, if you're just falling on a knee, a direct hit on the knee, so you can see that undisplaced transverse fracture of the patella, similarly like that. And then I've told you this is a complex fracture where there is more than 3 fragments. Whenever there are more than 3 fragments of bones, hence it is called as comminuted fracture. What do you mean by comminuted fracture? Whenever the bone pieces are more than 3. So fracture has to make the bone into 2 fragments, right? If there are more than 3 fragments, it is called a comminuted fracture. And whenever there is a twisting force involved, and this is called as your spiral fracture. So this is called your spiral fracture, right? And then whenever you're extending to the open environment, like whenever the skin is breached or the fracture is seen or connected through the skin, then it is called a compound fracture. Then it is called a compound fracture. And now tell me, Samantha, I told you what is comminuted. Transverse fracture is nothing but a pattern of the fracture. So the bones break in different varieties based upon the mechanism of the injury. If the injury is in the tension forces, it will produce a transverse fracture. For example, if this is your bone, so a simple slit in the bone is called, this is called a transverse fracture. Okay, what is comminuted fracture? Comminuted fracture is if this is your bone, now the bone breaks into multiple fragments like this, right? Right, so you can see there are multiple fragments here. So this is called the comminuted fracture. So simple and complex, it is not a very big difference between them. Simple is nothing but a simple transverse fracture, right? Or a simple oblique fracture. Complex is whenever there are more fragments or whenever it is associated with a dislocation, right? So these are called the complex fractures or compound fractures. So all these are complex fractures. Okay, clear everybody? Okay, now if you're clear with this, now tell me what is a Greenstick fracture? What is a Greenstick fracture? Yes. Okay. Simple and complex. Okay, what is a compound fracture you're asking? Compound fracture is nothing but whenever the fracture is exposed to outer outer environment. That means you can see the fracture from outside. The skin is open. There is a wound over the skin. Hence, this is called as a compound fracture. Okay. Yes, comminuted is not easier to heal because the surface area of contact is less. So for the fracture to heal, the surface contact area should be more. For example, if you take this transverse fracture, the contact area is more, right? So here the contact area is less. Hence, it is not easy to unite. Okay. Yes, all your doubts clear now? Can I move forward explaining you what is a Greenstick fracture? So to your surprise, whatever I have taught still now, this is all seen in your adult bones. Now coming to the very interesting part, that is the pediatric bones. That means in children, the what do you say, the composition of the bone is different, right? So in children, what happens is there is an water content which is very high in the bone. The water content is usually high when compared to the adult bone. So what happens is, for example, now we are going to do this experiment for me. Now you're going home, taking two matchsticks. One matchsticks you put aside, that is a dry matchstick. The second matchstick, you're going to put it in water, soak it for some time, and then try to break. Or I'll just imagine yourself when you're trying to break something which is filled with water. A twig, a tree twig, it will not break like a dry fracture, right? I mean, it will not break like a dry one. So whenever something is dry, you can just break it, right? So whenever it is wet, it will take some time and these little ends are connected, right? So that is what is the green stick. So green stick is, we have two cortices, right? So the one cortex, there is a complete break, and the second cortex, there is a bend. So this is specially seen in pediatric bones because there is a high amount of water in it. And now here, what do you mean by cortex? I know next question will be the same thing. So here you can see on the image. So this is one cortex I'm talking about. This is a second cortex I'm talking about. So if you see, there is a break in one cortex and you'll see there is a bend in the other cortex. So this is not a complete break like this bone. So there is a break in one cortex, bend in the other cortex. So this is called as a green stick fracture, which is usually seen in your pediatric population, right? Yes. So that is about the patterns, right? So now we have dealt with so now this is what you're going to write in the exam, right? So this is all your theoretical background inside your brain, but what you're going to produce in the exam is this particular image or this particular slide. So first you're going to put fracture, how you're going to write in the exam, right? Fracture, high issue, fracture, you will write the definition. So what is the definition of the fracture? You're going to write it is a breach or break in the cortex which will result in the discontinuity of the bone, right? And then you will write classification of the bone fracture. The bones can be classified based upon the etiology, based upon the exposed to the environment, based upon the displacement, based upon the pattern, based upon the complexity, and based upon the forces, right? So whenever you're talking about the etiology, we know it is a traumatic fracture or a pathological fracture or a stress fracture. So 1, 2, and 3. I hope you all can write the answer, right? And then I've explained you what is an open and a closed fracture. So open or a compound fracture or a closed fracture, right? Based upon its exposure to the outer environment. Then based upon the displacement, whether it is a displaced or an undisplaced fracture, right? Again, based upon the pattern, whether it's a transverse fracture, oblique fracture, spiral fracture, comminuted fracture, or a segmental fracture. Based upon its complexity, whether it is a simple fracture or a complex fracture. Based upon the force, whether there is a high velocity force involved or a low velocity force involved. Yes? Samantha, you follow the lesson properly. You follow the class I've told you because of the high water content. I told you clearly, right? Where is that? Here. Green stick because of the high water content. Okay, now you can write the classification. Any doubts? So this is for the people who want to get around, like if it is a 10 marks question, you will get 6 out of 10 for writing still here. But somebody who wants to get more marks, then you have to write even this. So what is this? So this is nothing but what are the types of displacements you can see in a fracture. So I've told you there are two types of fractures, right? Undisplaced, mildly displaced, and fully displaced, right? So whenever there is a displacement, what happens to that particular fragments? So those fragments can rotate, those fragments can angulate, or those fragments can translate, right? So these are the three things which can happen. So one of the fragments can rotate, which will result in rotation of the fragment, or it can angulate, or it can translate. Translate is nothing but either it is moving medially or laterally like this, right? Angulation and rotation in degrees, right? It is 10 degrees rotated or 20 degrees angulated. Translation is how much it is from the cortical surfaces. So for example, if you see this particular fracture here, this particular fracture here, so this is completely translated, right? It is completely translated. And if you see this is angulated. So this particular, this thing, the displacement here is angulation. So here it is translation, right? So these are the various displacements. So displacement can be rotation of the fragments, angulation of the fragments, translation of the fragments, or it could be impaction or shortening, right? So it could be impaction like this. So the two fragments get struck with each other, that is called as impaction, or sometimes, which will cause this impaction, sometimes results in what is called as shortening. Okay, so these are the types of displacement. So if you write this displacements also, you will get 7 out of 10, right? You will get 7 out of 10. So this displacement, what I'm talking about. So there will be a shift, that is translation, angulation, rotation, right? And you can also add impaction. So still here, if you're clear and you have drawn good diagrams, 8 is confidently they'll give you 8 out of 10. But still, if you want to get 10 out of 10, so this is for the people who want to score the highest marks. So this is the Muller's classification. This is higher level, advanced level of classification. Yes, yes, very good. So this particular point is, yeah, this is for the shaft. Yeah, whenever there are articular, you can only tell whether it is an intra-articular, right? So mainly the impaction is for the shaft issue. Impaction is for the shaft. But sometimes this rotation, you can also tell for the medial fragment and lateral fragment in case of humerus, if it is medially rotated or laterally rotated, right? And for the distal humerus, you can tell the translation also. So it can be somewhere applicable up to the distal level, not completely intra-articular. So if it is a shaft or above it, then you can tell, or you can tell it is an intra-articular fracture. So that is the displacements. Okay. And now this is for the people who want to get the highest marks. I told you this is the Muller's classification. This is mainly used for the adult bones, and this is by the AO and OTA classification. So orthopedic trauma associations. So this has been used worldwide, where each bone is given a number and each segment of the bone, like epiphysis, metaphysis and diaphysis, it's given a number. So each bone, for example, humerus is 1, forearm is 2, like that. Okay, each bone is given a number, and similarly in each bone, further this bone is divided into segments, like the epiphysis, metaphysis, diaphysis, like that. Okay, and that also is named as 1, 2, 3, 4. And here the morphology of the fracture is divided only into 3 parts. One is simple fracture, wedge fracture, complex fracture, or comminuted fracture, right? And again, these are divided into groups, each fracture. So if it is only ulna, it is called 1. If it is only radius, it is called 2. And if it is both, it is called 3. It is for the forearm. So now how do they name it? So for example, if this is the fracture, so this is the forearm bone, right? So the forearm is 2. Forearm, the number given to forearm is 2. It is arbitrarily set. The names or the numbers of the bone is set for everything. And the shaft is again 2. Right? The segment shaft is again named as 2 here. And because this is a simple transverse fracture, they are writing this as A. And because there are both bones are involved and both bones is group 3. Now the name of the fracture or the nomenclature of this particular fracture becomes 22A3. It is like the chemistry, we used to write nomenclatures, right, for the carbon and the molecule. So it is similarly like this. No need to understand this. If you just remember, you can put one word Muller classification, which has been also identified by the AO and OTA. AO is nothing but it is the Bible for orthopedics, for especially for the trauma. So we use this AO principles, right? So these principles we use to management or to treat the bones, right? So this is called the Muller classification. I've just put it for people who want to secure the highest marks. Okay, you can just understand it once you go home and read it again, right? So this is classification of the bone fractures. And now, so whenever you see a bone, and this is the fracture, and now can you tell me what fracture is this? Can you communicate this fracture to any of your seniors? No, simple fractures are not angulated. Simple fractures are just a transverse fracture. So there is no angulation in it. So now if you want to tell somebody that this is a fracture, so have group 3 is arbitrarily when two bones are involved, it is group 3. So one is for single bone, that is ulna. If only radius is involved, it is second group. And if two bones are involved, it is group 3. What happened? But here they can't see. Yeah. Now is it clear? Okay. Till where did you listen? So this is the fifth metacarpal neck fracture. It is a transverse fracture as you can see, and it is a closed fracture. So closed or open, you cannot decide on the x-ray. You have to tell it clinically only, because closed fracture which is not exposed, clinically only you can tell. There is nothing to tell on the x-ray. But you can tell this as a transverse fracture. You can tell that this is angulated, as we have discussed what is angulation as well, right? So that is how you describe the fracture. And now everybody who have listened the class has to answer what is this fracture. Now describe this fracture. Quick. Everybody. What is this fracture? I have explained you clearly what is this fracture. Yes, it is complicated only. Yes, I accept that. But what is the specific name given to this fracture? It is a complicated fracture. Very good. This is a segmental fracture. Mohammed. Mm, yeah, Mohammed. See, simple or complicated. Simple or complex is a very broad term. Usually we don't encourage such classifications. They're very broad. Something can be as simple as, and something can be a complex fracture. There is no specific thing which have been put in simple and complex. What they're trying to tell is complex is whenever there is a multiple fragments, whenever it's a comminuted fracture like that, and whenever it's a broadly displaced. So these are complex fractures. Yes, it's a complicated, I accept. But what is that particular word I'm asking? Particular word given to this fragment. So this particular fracture, whenever you see this particular X-ray, you can tell that this is a segmental fracture. That is what we expect. So this is a segmental fracture. Yes, I accept this is a complicated fracture. It is a displaced fracture. It is broadly displaced. All that is true. But what I am trying to extract from you is that particular word segmental. So that is how you have to answer in the viva as well. As they put this extra, you have to tell that this is a segmental fracture. Okay? Is this clear, everybody? Yes, so that's complete. And now I have already told you. Very good. Perfect. Displays segmental complex fracture. Very good. Perfect. Okay. Now I have also told you at the end you are going to write what is the importance of the classification. It is for greater communication. It is for management and the prognosis. Right. So all this put together you will get full marks 10 on 10. So that completes the fracture. Very good. Femur fracture. Very good. That is the main thing which we have to tell. Now, let's go and learn about healing of the fracture. Now, we have learned so much about the fracture, right? So, types of fracture, what are the patterns of the fractures. Now, patients are not interested in what type of fracture is a comminuted or what. They only ask you, how does this heal? What we have to do for the healing, right? So, now let us understand what is that healing of the fracture. So how does the fracture heal? Now we have to be very, very careful. Okay, I'm going to tell you very, very important points. So these important points can also be helpful for you in your exam, that your MCQs, I have heard that there are MCQs also, right, for you. Okay, so now let us understand what is a fracture healing. So you all know that the fracture, whenever there is a fracture, so for example, if this is your bone, so let us talk about a simple fracture. So this is a simple fracture. A simple fracture, right? Now this has to heal, but this bones, the healing capacity is very, very good because they have a particular mechanism which is called as remodeling. So this remodeling is a particular mechanism where this fracture will become exactly like this. Can you see any difference? So it was a normal bone, it has fractured, and now because of this beautiful process of remodeling, it becomes exactly like this. Means it is near normal. So over a period of time, you cannot even identify that this bone has been fractured. If it was a simple fracture, and it will heal so well that it becomes 100% normal. But how does this happen? What is the mechanism which is involved in it? And let us see what is this beautiful process of remodeling. So whenever there is a fracture, so this fracture also, depending upon the type of the fixation or how do you treat it, that tells you how does it heals, right? So this healing of the fracture is of two types. It could happen through a primary healing or a secondary healing. Please listen very, very carefully. First time you are listening to this chapter, it will be very confusing, but trust me, over a period of time, you will understand every bit what I spoke. Right? So I am teaching you fracture healing. So this fracture healing is of two types. One is primary and second one is secondary. This primary is also called as a direct healing, and this secondary is also called as indirect healing, right? Very easy. Do you remember direct and indirect? Direct is primary, indirect is secondary. So what is this direct? So direct is, this is the fracture, and now what happens is there is no gap between them, and with the direct union it will heal. Okay, so because they are so close to each other, there is no gap between them, and hence this is called as a direct contact healing. So the union happens with direct contact healing, right? Contact healing, right? Direct contact healing. Now I'm telling you secondary and indirect. As the name suggests, it is indirect. Indirect. So direct and indirect. So what is indirect? You know, no, it is a common sense. Direct is, so if you love somebody, you go and propose them directly, it is a direct proposal. But if you're telling somebody and asking them to go and tell, it is an indirect proposal, right? So it is that way. So this indirect healing is through a friend, as you have used. So this is called nothing but a callus. So this is called as the callus. So whenever there is a union of the bone through this callus, so somebody is involved. So somebody is involved. So this is called as the indirect healing. So this is called as the indirect healing. So this is through the callus. Clear? Primary direct, secondary indirect. And what is the somebody who is coming in between indirectly? So that is your callus. So whenever there is a formation of this callus, and that will result in the bone healing. So there is a process of this formation of the callus. What is callus? Yes, expected, Samantha. What is callus? So callus, I will tell you. What is callus? I'll tell you. So there is a formation. So this callus is formed through a process, and this will undergo certain stages. So I'll tell you the stages. So first is stage of hematoma. Right? The second one is stage of inflammation. Third one is stage of callus. Fourth one is stage of remodeling. Before that, Samantha, you're from which prof? So, so these are the four stages, and this callus I have told you is formed at stage 3, and for secondary or indirect healing, the bone has to go, or the fracture gap has to go through all these stages. The first one is stage of hematoma, the second one is stage of inflammation, the third one is callus, and the fourth one is remodeling. And what happens is there is a time period for this. So the first, initially from the time of the injury through 3 days, it is hematoma, right? And from 3 days to 3 weeks, it is callus. And from 3 weeks to 3 months and up to 3 years, the bone will remodel. The bone will remodel. Okay. So hematoma, when it is formed, hematoma is formed at 0. And then after 3 days, it is your inflammation. After 3 weeks, it is your callus. And after 3 months, it starts remodeling up to 3 years. And there are two types of callus. So one is called the soft callus, and the second one is called your hard callus. Right? So this is how the bone heals. So first is primary or direct healing, where there is a contact healing, there is no gap between them. And the second one is the secondary or indirect healing, which heals through callus. And there are stages for it, which is called of stage of hematoma, inflammation, callus, and remodeling. And there is one more terms which are given to this is because, okay, now let me explain the stages and then they'll tell you the name. So this is the diagram which you're going to draw in the exam for fracture healing. Right? So you're going to draw a bone, then show a fracture in it, and then you're going to show the stages. Stage 1. So this is stage 1. This is stage 2 is your inflammation. Stage 3 is your soft callus. And finally, this is 3A, soft hard callus B. And finally, your remodeled bone is stage 4. Okay. Now I will tell you what are the stages. So once the fracture has happened, so this is a story, just remember. So this is a fracture. As soon as there is a break in the bone, there is filling of the blood, right? So the blood, okay, I'll take the bone as blue color. Okay, now this is the fracture. And once there is a fracture or break, so the capillaries break and there is a lot of blood which is pooled here, right? So this pooling of the blood as soon as the injury happens is called stage of hematoma. And now the fracture is fragile and it keeps moving, hence the patient will have severe pain and you need to splint it immediately because the fracture movement has to be restricted for reducing the pain, right? So that is hematoma, and this is there up to 3 days. So soon after 3 days, what happens is, after 3 days, what happens? Now there will be stage of inflammation which is setting in. So this is the inflammation, right? So what happens in inflammation? Now there is a signaling of the body which is happening. So now the body understands that there is a problem somewhere. So there is a break in the bone. So now the body reacts through the inflammation. So what happens in the inflammation? So your all your inflammatory processes, so everybody comes there, your your whatever the phagocytes, your neutrophils, all those inflammatory mediators, your cytokines, your growth factors, everybody will come. Yes, displaced fracture. No, it is not about displaced or undisplaced. Whenever there is a gap, every bone has to go through this. Every bone has to go through these 4 stages. Any type of fracture, all, even if it's a spiral, it's an oblique, it's a segmental, all fractures will go through this phases. Okay, Mohammed? Yes. Now what is happening in the inflammation? In inflammation, all those mediators are coming in and they are setting inside. So all those growth factors, everybody, and these mediators have come. Yes. So when issue is helping me, your serotonin, macrophages, neutrophils, eosinophils, everybody will come. And now what happens? Slowly the blood gets absorbed. So there is no hematoma. Now there is an inflammation. So what is inflammation end product? So now there is a granulation tissue which is formed. So there is a granulation tissue which is formed now. And now after 3 weeks, so this is up to 3 days to 3 weeks, right? So now, and now what happens after 3 weeks? After 3 weeks, what happens? This granulation tissue, whatever is there, no, all the growth factors, the VEGF, the BMPs, that is bone morphogenic proteins, the vascular endothelial growth factors, your insulin-like growth factors, your cytokines, all will release chondrocytes. So chondrocytes is nothing but your cartilage forming cells. So now there is a matrix, that is granulation tissue, and now all the chondrocytes will form their cartilage. So this is the cartilage. So whenever there is a cartilage which is formed between the bone ends, this bone, whatever the gap which is there, this becomes sticky. So this formation of cartilage is called as the soft callus. So this formation is called as the soft callus. So the cartilage, the chondrocytes will set in and this they will form the cartilage. So this is called the soft callus. Now your fracture fragments become sticky. Hence after 3 weeks the patients will have reduced pain, right? Because the fracture fragments are not very mobile as they were before. Now what happens? Now these chondrocytes, they get differentiated into osteoblasts. So this cartilage now is converted into bone. So this is an immature bone which is forming here. So this immature bone now becomes a hard callus. So this cartilage is soft callus and now this bone is called the hard callus, right? So this is up to 3 weeks and this is up to 3 months. So once they enter the phase of 3 months, then they will have this hard callus. And finally, after 3 years, so from this 3 months to 3 years, again I've told you, right, there is a remodeling which is happening, and because of this remodeling, the bone becomes normal. So this is a normal bone, there is no fracture. So it is completely united. So this is completely united. So this is a fracture and this is the union. So this is how the bone gets united. Fracture, hematoma, granulation, callus, remodeling. Fine? Clear? Any doubts? So now this is the diagram which you have to draw in the exam whenever they ask you about your callus. Okay, Nishu. Here again, it's a good question. See, 3 years it gets remodeled. That means you're not going to immobilize the patient up to 3 years. Whenever the soft callus is forming, you can start the mobilization. Because of that, now your Wolff's law will come into play. So Wolff's law is, oh, so now what happens is the Wolff law. What the who was that? I think Sabyasachi has told, because now we are putting pressure onto the bone. Now the patient starts walking after 6 weeks. That is almost up to 6 weeks is 1.5 months, right? So after 2 months or so, we start weight bearing to the patient. So whenever it starts weight bearing, the bone will become stronger and stronger. And 3 years, they will become completely normal. What I meant to say is, it is exactly like the normal one as it was before. Not two, it is not exactly 3, it is usually 2 to 3 years. Okay, because I want everything in 3, I am telling you that way. So 3 days, 3 weeks, 3 months, and 3 years. That is how you usually remember. So this is the time where your implants has to come out. So less than 3 years, you can suggest the patient for your implant removal. So this is how the bone is completely remolded and becomes normal. So now you can plan for the implant removal, right? Yes, clear, guys? Any doubts? Yes, how does callus appear? So this is again, you can see this hard callus. So soft callus is nothing but cartilage, right? So whenever you see soft callus, it is nothing but the cartilage. So you can see the union which is happening. So the gap, whatever the gap was there in the present, I mean, like before 2 or 3 weeks, that becomes slightly united. So you can see some fluffy things on the x-ray, and hence you can tell the patients that the union has started. So if it is if it is like this, the hard callus, you can directly see on the x-ray, right? Because it is bone. So you can see that there is a union which is happening, right? So that is how you will tell the patient that whether it is uniting or not. Okay. So usually what we do, once we do the surgery, day 1, then the x-ray we repeat after 3 weeks, right? Then again we do it after 2 months. So that is why we will understand whether the union has started or not. Okay. So that is about the bone union. And now, so I hope you all understood this very clearly. Now again, I'm going to tell you a very important concept on this. So if you understand this clearly, we can go to the concept. Yes, now you all got what is healing and all, no? So now tell me, okay, for example, this is your tibia. Okay, now this is your tibia, right? That is why we'll tell rest for 3 months. Yes, good. So now what happened is we got a fracture tibia. So now before that, you have to understand that tibia is a long bone and it is a weight bearing bone, right? And now I will tell the other one. So now this is your radius. Radius, I am telling you that this is a forearm bone, right? And non-weight bearing. I mean, you don't put weight on it, right? So this is a forearm bone. And not to forget that you have the friend of the radius, that is your ulna, right? So we have radius and ulna here. So this is the radius and this is the ulna. Okay. So now what is my question is, there is a radius fracture and there is a tibia fracture. Okay. So there are two fractures here. And now you know what is the type of fractures, you know how the fractures heal. So now you tell me, how do you suggest this treatment? How do you treat it? I mean, what are your treatment options? What are your treatment options? So I will tell you your inventory, that this is your instrument box and there is a nail in it. Okay, let us assume that this is a plate. So there is a plate in it and there is a nail in it. So there is a nail and there is a plate. So these are what? There is a cast also in it. Okay. Okay, these are the multiple treatment options. So how do you suggest the treatment to the patients? That is what is my question. So plate for whom, nail for whom? So tibia, nail, or yes, mobility should start after your soft callus formation. Yes, correct. Hmm. So to understand what is the treatment of any fracture, first you have to understand about that particular bone. So now I am telling you two important bones which are usually be treated or prototype for treatment. So we can take the femur bone and the tibia bone as a prototype for a long bone which is weight bearing. Okay. Yes, all these implants and instruments are mainly for the weight bearing. So weight bearing, so now what happens is whenever I'm talking about tibia or a long bone or a weight bearing, so I want strength in that particular bone, right? Do you agree with me? So there should be strength in the bone, like I'm weight bearing on that particular bone. So it should be strong. So this strength of this particular bone comes from callus formation, right? So there is a bone which is solidly formed, so be various stages it has gone through, and there is a callus formation, hence this is forming a very good strength for the bone, right? Yes, tibia you can't give rest, and tibia you can go for casing if it is an undisplaced bone. But if it is an undisplaced bone, you can go for the casing. But again, there are again disadvantages of it. Whenever it is casing, you have to tell the patient not to walk for certain period, and again you have to keep checking for every week for the displacement. So in the cast, it can get displaced, right? Because we are not holding the fragments. But if you put a nail, that means we are holding the fragments, hence you can have the control over the treatment, right? So now what I'm trying to tell you is whenever you want to treat a long bone such as your tibia, such as your femur, what happens is you have to think that this bone has to be very strong. So the strength of the bone is again regained by the callus formation, hence you have to opt for what healing? What healing you have to opt for? Is it a primary healing or secondary or a direct or indirect? What type of healing I want in the tibia, which should include a callus formation? Quick. Yes, faster. We have so much to discuss. It is already 7:30. Yes, very good. We have to go for the secondary healing. We have to go for the secondary healing or the indirect healing, right? It is secondary healing or the indirect healing which we want for the callus to be formed, right? Yes, very good. Secondary or indirect healing. So how does the secondary or indirect healing will occur? There should be a gap for it. So it should not have a direct contact. So there should be some gap for it. So whenever there is some gap for it, there will be small micro motion which is happening between the fragments, and this is through the controlled micro motion which is happening, and this will result in the formation of the callus which we want, right? So how do you achieve this micro motion? So this micro motion or this controlled we are taking help of the nail. So whenever you put a nail through it, whenever you put a nail through the tibia, so this is the nail which we are putting through the tibia. Okay, nails should stop here. It's going outside of the tibia. So, and then we are fixing it with the screws, right? We are fixing it with the screws. So, this is called as then intramedullary interlocking. So we are putting inside the medulla, hence it is called as intramedullary, and we are locking it proximal and the distal. So this is proximal and this is the distal. So we are locking proximal and the distal. So this is called as intramedullary interlocking nail. So this is called as intramedullary interlocking nail, and this will give what type of stability? It will give a relative stability. So this will give a relative stability. That means it is not close. So there is a gap which is there, and this gap is filled by the callus. So what nails give? Nails give a relative stability which will result in secondary or indirect healing, right? Which will result in secondary or indirect healing. Yes, there should be some gap, not wider gap, little gap which is taken care by the nail itself. So it is not directly in compression. So whenever it is coming to radius, so this is about the tibia, we are having small slight gap, not gap means not a big one, a small gap just to allow that motion, that slight movement of the fracture, right? And now we are dealing with the radius. So here I have told you that radius is a forearm bone, and you have to be careful that this is enclosed in a single compartment like this, and now in between you have a interosseous membrane, right? You have a interosseous membrane, and now for this radius you want, usually what we say is, so usually we say the forearm bone is a type of a joint. So because it is connected in the distal, proximal, and in between there is an interosseous membrane. So we will treat it as an articular fracture. What do you mean by articular fracture? That means somewhere near the joint. So now somewhere near the joint, do you want the callus to be formed in the joint? Yes. So do you want a callus to be formed in the joint? So for example, this tibia, the same tibia bone has been broken here in the proximal part, which is in connection with the joint. So here also you want the callus to be formed in the joint as well. Quicker. So we don't want any callus, no callus. Yes, we don't want a callus to be formed in the joint. So in the joint, if the callus form, what will happen? It will cause restriction of the joint, right? There will be no movement of the joint. Hence, we don't want any callus in the joint. Hence, for any intra-articular fractures, so any peri-articular, that means around the joint, inside the joint, what we want is no callus. We don't want any callus. If you don't want any callus, then what is the type of healing we are expecting here? If no callus is formed, what is the type of healing we are expecting here? Quick. Yes, very good. It restricts the joint movement. So there is no callus, then what is the type of healing? Is it a direct, indirect, or a primary or a secondary? So we are expecting a primary healing. We are expecting a primary healing, which is also called as a direct healing, and this direct healing is by contact union. So this is by your contact union, right? Very good. Primary. So contact union. So how will you achieve that contact? So here what we do is we put a plate. So this plate, we will lock this plate with the multiple screws above the fracture, below the fracture, and we will create compression such that there is no gap. And now this type of stability is called as the absolute stability. Okay, so this plate which we are fixing here will result in a direct healing, primary healing, no callus formation, and this is called as an absolute stability. And here in the nail, we are creating small gap with the controlled micromotion, and this is giving what is called as a relative stability. Right? So this is how the fracture heals, and these are the types of fracture which is called as a direct. Sorry, this is indirect and this is direct. Okay? Is this clear? No confusion, right? So this is what you have to write for the answer. So whenever they ask you about fracture healing, you're going to write fracture. What is a fracture? And this fracture usually can occur by variety of ways, and then healing of the fracture occurs by two different ways, which is called a primary direct or secondary indirect. And secondary indirect is through formation of the cartilage, hence this is called as endochondral ossification. Endochondral ossification. As I've told you that there is a formation of the cartilage, hence the name enchondral ossification. Not endo, sorry, enchondral ossification. Enchondral. So chondra is cartilage. So enchondral ossification is secondary or indirect, and primary and direct is called as intramembranous ossification. Intramembranous ossification, right? Clear? So this is about the fracture healing. So this is intramembranous, this is enchondral. So why the name enchondral? Because it is going through multiple stages where the cartilage is involved. Here there is no cartilage involved, hence there is a intramembranous ossification which is occurring. And for secondary or indirect healing, we need callus to be formed. So how the callus is formed? We put the nails through it. So nails will produce callus, and this callus will give strength. Hence we go for an indirect or secondary healing. Primary, which now what is the stability we are getting here? What is the stability we are getting here? Secondary or indirect? It is the relative stability. This is what is very, very important. This is relative stability. This is absolute stability. Absolute stability, matlab it is absolutely in contact with each other. There is no gap which is present and there is no callus which is formed. Clear? Yes, this is all you are going to write in the exam for your complete answer. And now there are factors. Sometimes what I'm telling, the fracture healing will result in what? Union. We said, right? We said which is union. But sometimes there are certain factors which happen, and then there will be complication of this union. Complication which is called as a delayed union, or this can be a non-union where there is no union which is formed, or it is a malunion where there is a malalignment of the union, right? So these are the complications of the fractures. Yes, yes. And what are the factors? The factors can be from the patient, from the surgeon, treatment or the doctor, or by the bone itself. Right? Can you tell me what are the patient factors which might result in a delayed union or a non-union or a malunion? Patient factors. Yes. Old age. Right? Old age, patient, alcoholic, diabetic, smoking as a very, very fracture happened for cortex, nothing to do with the marrow. Okay. Okay, so for example, if this is your bone, this is your bone, and now there's a crack here, right? So this is exactly your bone. So now this is the cortex and this is the marrow. Marrow is nothing but the hollow portion inside it, right? Okay, it is just a hollow portion. It's just the name of that particular part. When you're fixing the bone, obviously the marrow will become continuous. Okay? Okay, you get my point? I'll tell Samantha, I did not explain about non-union and non-union. I just told the names of the complication. That's it. So now these are the patient factors. So if a patient is an old patient, because younger ones heal better, old ones take time. And if a patient is alcoholic, if a patient is having diabetes, if the patient is smoking, and if the patient is on steroids, So all this will have an impact on union, right? And surgeon factors, he has to do proper reduction, right? So reduction maneuvers has to be very proper. Selection of the implants, right? So selection of the implant, sometime it will result in implant failure. For example, we can put a nail for a plate and a plate for a nail, so that happens, we do it, but you have to properly train the bone to take the load. So selection of the implant and immobilization protocols, if not properly followed, so that is again the surgeon's mistake, right? And for bone, so what are the mistakes of the bone? What bone does mistakes? So if it is a compound fracture, so there is a lot of comminution in the bone. Or if it is a particular bone with the vascular supply, so vascular supply like your scaphoid or your talus or your femur head, so there is a, the vascular supply is from proximal, distal to proximal, right? So this have a atypical blood supply. These three bones have atypical blood supply, right? So that is why the non-union or delayed union might occur. Now I'll tell you, these are certain factors, right? You just remember them. You can write 5 or 6 of them, nothing more, nothing much importance is given to these factors. Just remember, there are certain factors, and sometimes what happens is the bone itself, there will be soft tissue imposition, soft tissue interposition, right? uh, so there will be a lot of soft tissue between the fracture fragments which are not removed, hence the healing might get delayed, and sometimes there will be bone loss because of the fracture itself, right? And these all can happen, right? And now what are the terminologies? So now I told you this is a fracture. So so always you should weigh the benefits, Sabyasachi. It is never, so that is why medicine is called an art. So medicine is not about reading your textbooks or getting your exposure and all. It is based upon your experience, and you should always weigh the risk and the benefit analysis. It is, that is why it is called an art. So if the same patient is having a condition where the bone has to heal and he has to put on the steroid, so obviously if it is a life saying, if